Every 34 seconds, someone in the world dies from a heart-related cause. That's more than any other disease, more than cancer, more than infections, more than accidents. Today we're talking about the #1 cause of death worldwide, ischemic heart disease, often called coronary artery disease. It's silent, it's deadly, and it's often preventable. In this video, we'll cover what it is, why it happens, how to spot it early, and what you can do to protect your heart starting today. The word ischemic simply means reduced blood flow. In this condition, the arteries that supply blood to your heart muscle, called the coronary arteries, become narrowed or blocked by a buildup of plaque. Plaque is made up of fat, cholesterol, calcium, and other substances. Over time, it hardens and clogs the arteries, reducing oxygen-rich blood flow to the heart. When your heart doesn't get enough blood, it can cause chest pain, angina, and if a plaque ruptures, it can trigger a heart attack, myocardial infarction. This whole process is known as atherosclerosis, and it can start silently decades before any symptoms appear. According to the World Health Organization, ischemic heart disease kills nearly 9 million people every year. That's about 16% of all global deaths. It doesn't discriminate. It affects people in rich and poor countries, men and women, young and old. But what's really alarming is that many of these deaths are preventable. Lifestyle factors like unhealthy diet, high in sugar, salt, and trans fats, lack of physical activity, smoking and alcohol use, chronic stress, and obesity are responsible for most of the cases. Urbanization, long working hours, and processed foods have made heart disease a global epidemic. The tricky part about heart disease is that it often gives warning signs, but many people ignore them. Common symptoms include chest pain or tightness, especially during exertion, pain radiating to the left arm, jaw, or back, shortness of breath, cold sweats or dizziness, fatigue even after mild activity. In women, the signs can be subtle, like nausea, back pain, or unexplained tiredness. Ignoring these could be the difference between life and death. If you ever experience these symptoms, get checked early. Diagnosis usually starts with ECG, electrocardiogram, to check heart rhythm. Echocardiogram, echo, for heart structure. Stress test to measure how your heart performs under activity. Blood tests for cholesterol and cardiac enzymes. And coronary angiography, which uses dye and X-rays to see if arteries are blocked. Detecting the problem early allows doctors to treat it before it leads to a heart attack. The best treatment for heart disease is prevention. Here's what you can do right now. 1. Eat a heart-healthy diet. Focus on whole grains, fruits, vegetables, nuts, olive oil, and fish. Cut down on sugar, fried foods, and red meat. 2. Exercise regularly, at least 30 minutes a day, 5 days a week. Walking, swimming, or cycling. Consistency matters more than intensity. 3. Stop smoking. Smoking damages arteries and raises bad cholesterol. Quitting reduces your risk dramatically. 4. Manage stress, practice mindfulness, yoga, or deep breathing daily. Chronic stress releases hormones that strain the heart. 5. Get regular checkups. Monitor blood pressure, blood sugar, and cholesterol, even if you feel healthy. 6. Medications and procedures. Doctors may prescribe statins, beta blockers, or blood thinners. In severe cases, angioplasty or bypass surgery may be required to restore blood flow. Ischemic heart disease may be the world's biggest killer, but it's also one of the most preventable. Your heart doesn't fail overnight. It sends signals long before the crisis. Listen to those signals. Eat better, move more, manage stress, and get checked regularly, because the life you save could be your own. Don't ignore chest pain. Protect your heart. One small change at a time. Like this video, comment your thoughts, and subscribe for more health awareness content.